The Ministry of Health has been implementing various strategies to fight various cancers. At a press conference on Friday, Health Minister Dr. Frank Anthony noted that the cancer registry was updated. There has also been a significant time improvement from biopsy to diagnosis. Previously, the results of a biopsy took approximately 3 months. Now it has been reduced to less than 7 days at the GPHC.
We are going to introduce in the first quarter of next year telepathology. This is another project that we've been working with Mount Sinai on. We have already bought the equipment to do telepathology. We have started the renovation of a section of the Georgetown Hospital to accommodate this new lab. And once that is completed, we will install the equipment. We have already trained the staff of the hospital to be able to do telepathology, and they would be directly linked to the Mount Sinai lab.
Basically, high-resolution images will be taken of biopsy samples, which will then be forwarded to a pathologist at Mount Sinai Hospital for a diagnosis to be made. This will also help improve the waiting time for results. Meanwhile, breast cancer accounts for most of the cancer diagnosis locally.
When we look at our stats for this year, breast cancer remained the #1 cancer in Guyana. This year, we diagnosed 161 persons with breast cancer. This accounted for 17% of all cancers diagnosed this year. So this is something we have to work more on in terms of reducing this burden. And one way of doing that is that we have to encourage people to get screened and get screened early.
The ministry is working to get more women to have mammograms from 40 years and older, or between 30 to 40 years, once they have a family history of the disease. Genetic screening will also be done in the near future. 3 more mammogram machines will be added and placed at the New Amsterdam, Linden, and West Emrara Hospital. Cervical cancer is the second most prevalent cancer, with 102 cases diagnosed this year.
There is a very cheap and effective method in preventing cervical cancer, and that is HPV vaccination. Unfortunately, a lot of people are not taking the HPV vaccine. And the new guidelines from CDC as well, from 9 to 15 years of age, you can now get a single dose HPV vaccine. If you were 16 years and older, previously this was not available, these are new guidelines. 16 years and older, you can get 2 doses at a 6 months interval, and that would help to prevent cervical cancer.
Guyana has HPV vaccines in stock, and these are available to the public free of cost. The ministry is hoping that more persons will do vaginal inspection with acetic acid, VIA, pap smears, and HPV testing.